not seen any long-term side effects with the vaccines. The vaccines are very, very safe.
The vaccines, they're safe and effective, and they're our best way forward. And I'm looking forward to when we can be together again without masks and hug. And I think the more of us that get the vaccine, the closer we are to getting back there.
On today's episode of Health Centers on the Front Lines, we're talking with Lowell Community Health Center's Jeanmerli Gonzalez and Brent Carney. Thank you so much for being with us today.
So we're just out there making a presence in the community and being around. A lot of the folks we serve are people who don't speak English as their first language, and I'm sure we'll get into that later. But so as an example, like I speak Spanish, so a lot of the times I'm speaking Spanish, greeting folks in their language. We're seeing people who, healthcare is probably not on the forefront of their minds, and they're worrying about work and other situations. We're seeing folks of different ethnic backgrounds. We have Hispanic Latinx folks. We have Black African American folks in our community. We also have a large population of Southeast Asian folks in our community. We are actually, I believe, the second largest Cambodian population in the U.S. So we have a lot of people in our staff that do actually speak Khmer to help facilitate that conversation.
I think when you look at the health center overall, we're at about 400 staff. About 40% of those people actually live in Lowell. And when we look at the board makeup, 51% of our board are consumers and patients at the health center. In total, we serve about 31,000 patients every year, and 41% speak languages other than English. So that language access really is such a critical piece for us. We're always trying to find new ways to communicate with the patients, and language access is a critical piece of that. Where you've instituted, messaging. We've instituted a chatbot feature that is accessible and will be accessible in multiple languages. All of the material that we put out, we translate and post in multiple different languages. When you walk through our building, even the signage is in multiple languages. So whatever touch points we can have, we try and use all of those available to us.
What are you seeing as the challenges remaining as you try to protect your community against COVID-19?
I think that, it's good to put it in perspective for us as a health center, because, we serve such a diverse population. And when you take a step back, at one point during the height of things here in Lowell, they had a positivity rate of about 10%. Our patient population had this at the same exact time was at 38%. So we knew right away that we needed to find ways to really reach out and get into the communities. Our patients were not going to mass vaccination sites. And I think, that's really kind of the direction we've taken, is that it's a one-to-one interactions are critical for getting the remaining population vaccinated.
One example is, we're out in the community tabling at a community event, and what we do is, I have a colleague of mine who speaks Portuguese, and she was actually able to walk someone through the process, give them the education at that moment, tell them a little bit about the vaccine, the side effects, answer any questions that they may have that my colleague was able to answer. And then that gave them enough confidence to be like, okay, I'll get vaccinated, but I need you to support me. So my colleague was able to actually walk her through the motions, going through the paperwork, going through, actually interpreting the questions that the pharmacist or the EMT was asking. And the community member actually got vaccinated. And I don't think that if my colleague wasn't there with that ability to speak a different language and as a support system, that community member wouldn't have been vaccinated. So our role really is being personable, being there, being human, understanding where their background comes from, right? Understanding their lived experiences and being from the same population of the community. we can say that, you know, a lot of the times we've experienced the same thing. So it's that sympathy. And through that, we're able to build like that trust and walk them through the motions and actually get some folks vaccinated.
And what are you finding are the messages that are resonating most as you talk to people about the benefits of COVID-19 vaccination, if that is your approach?
Yeah, I think it's one, it's building that trust. So making sure that we're being consistent with anything that we put out there, but it's more so the concept of like, let's get back to normal. Let's not make our families sick, and keeping that family oriented approach to things. And then making sure that we're bringing providers to the forefront. Along a lot of the videos that we're putting out as well have providers or community health workers or people that are actually in the community saying the same messaging of, you know, get vaccinated, talking about that misinformation.
The biggest barrier right now is really misinformation. And that's, you know, across the board. So we're trying to make sure that we battle that misinformation and in unique ways by trying to get providers on social media doing videos. Jeanmerli going out to events and talking to people, and other community health workers doing that. So we're trying to find as many ways as we can to educate. And I think that's, you know, really very critical. We've also held ourselves really accountable. Our board passed a resolution declaring racism a public health crisis a year ago, June. And we've, through the vaccination process, put together a vaccine equity report to track individual vaccines with how it's being distributed within the community to make sure that we're reaching people in a very equitable way. And when we found areas that we could do better, we strove to do that. So, you know, it's a combination of these things that have helped to allow us to be successful. And certainly, there's a long way to go. But I think we're all, you know, we all feel good about what we have done, and are looking forward to continuing to make progress.
Recently, we had a collaboration event with a few partners, specifically tailored for Hispanic Latinx population, and a new mom came into the table and was like, man, I don't want to get vaccinated. I haven't gotten one through my pregnancy because of, you know, all of the misinformation going around in the community. And one of the things I told her my experience. So I'm not a mom, but my sister is a mom, and my sister got vaccinated. And I was able to say, like, you know, she got vaccinated during her pregnancy, and, you know, through her experience, and, you know, she had her baby and her baby's fine. And I was able to like walk her through, you know, there is nothing that says, no information that, you know, directly says that there's an effect on the baby. They're actually recommending, you know, pregnant mothers to be vaccinated. And she, you know, she thought about it, and she's like, okay, you know, maybe I'll think about it and I'll circle back. And I didn't directly walk her through the motions of getting her vaccinated and things like that, but I was talking to some other person, and I looked to the side, and the lady was actually getting vaccinated at the tent right by our table. And I was like, huh, I guess being able to have that conversation and telling them about, you know, your own experience with the vaccine, I think that adds value, and being personable and being real. I think that's the most important thing. I think it's important to understand that dropping into a community and saying, you know, get vaccinated and it's the best thing to do, and then just leaving that community makes it kind of hard to spread that information. Now, the increased touch points, right? Going to that same location multiple times, talking to the same people multiple times, spreading the word, seeing the consistency of people in the community making a presence builds that trust. And I think making sure that you are a consistent face in the community, that you are saying the same things, makes it, and those conversations, those one-to-one conversations, makes it a lot easier to help combat that misinformation, because they're like, oh, I trust you. I've seen you multiple times. You're dedicated. You're not just dropping in once or twice. You're coming here often, and you're you know, you're supporting the work and you really believe in it. So I think that's important.
And I think that's why community health centers is so well positioned to do this work, because we're in the communities well before COVID happened. Our roots are very deep in the communities we serve. So that has allowed a lot of the legwork happen before COVID ever happened. So we had those connections, we had those relationships. And, people right now, it's not about hearing from politicians saying that people need to get the vaccine. It's hearing trusted friends, trusted sources. It's their doctors, it's their nurses, it's their siblings, it's their friends. Those are the people who are going to make the difference in somebody getting the vaccine or not.
I want to say that we have a bi-weekly meeting on Tuesdays with a lot of the community serving partners. When we bring them to the table and we talk about, okay, what is working, what is not working, and how can we work together to combat them. And out of that meeting, we actually brought out a block party that came out of that meeting, and we brought together different community organizations to really bring a fun way to vaccinate folks. And we got a lot of people vaccinated when we were thinking, oh, not many people are going to get vaccinated. And that was a time where about 12 people, 10 people were getting vaccinated at every clinic, and we got 60. So it's really bringing those community partners like the hospitals, the community service organizations, those housing authority coordinating groups to the table. We have our Latinx community serving agency. We have our Kamai community serving agency, and just bringing those folks to the table as key messengers, as people who still need the information, and as people that we can work together to kind of get the work done.
And the city's been a huge player in this as well. They've really helped coordinate, and they've been a real strong partner to all of us working on this effort.
How have you been approaching vaccinating the 12 to 15-year-old group once that vaccine became available and on an ongoing basis?
One thing we had been doing, I don't think we have had just more so communication within the health center to our patient population. But then we've also actually gone to the high school, the local high school. We tabled there a few days of the week, and then we tabled there. It's that multiple touch points that we talked about earlier. So we tabled there Tuesday, Wednesday, and then Thursday we said, well, we'll have the vaccine there. So seeing the same faces, the same people, and then we kind of just had folks get vaccinated on a Thursday, and a handful of students got vaccinated, and with their parents' consent and things like that. So that's how we've been approaching it, kind of making it a presence at school, educating the student, and then sending them home with information to bring back home, and kind of plug that seed in with their parents and get that the permission.
We actually have branches within the high school and middle school here in Lowell. So we have an ongoing presence in those two locations, and the staff there have really worked, tirelessly to try and educate the students, especially in the high school with that age group. And as Jeanmerli said, having vaccine clinics for those students, it's been somewhat successful, but I think there's been a lot of ongoing education that's part of it too.
And just on that point you were making about tabling at the school for a couple of days and then offering vaccines on the third or the fourth day, what were you tabling? What was the nature of the tabling the first couple days?
Yeah, so we had a school lunch. It was during school lunches. So this was particularly at the high school with our school-based health center. So we put a table up with a lot of goodies, giveaways, hand sanitizers, water bottles, flyers. We actually have a team block program that was also there, sharing their activities. So it kind of brought students into the table. And then we actually, we didn't just stand at the table and kind of had them come to us. We went to them. We sat at their lunch tables. We say, hey, have you heard about the COVID vaccine? And did you know that we're having it on Thursday and that you can get it here at school? And kind of having that one-to-one conversation that we've been speaking about. And, from that conversation, a lot of students were like, oh, but I'm scared. I don't know. And, take this information, bring it back home, read it, take your time, talk to your parents. and then come back. And we're here on Thursday, and that's when we're getting vaccinated. And then on Thursday again, when we were vaccinating, we were doing the same thing. Hey, like, this is the vaccine, look at your peers, they're getting vaccinated. Some folks are already vaccinated here with you, and kind of, making it personable and making it, coming off of that, like, we're a health center, but we're more like we're the community. We're your family, we're your friends, and this is how the information we have.
So Lowell was one of the first health centers to require staff to get vaccinated. This was before the Biden administration's announcement. I think you issued the requirement back in August. What was your staff's reaction to it, and what has worked best in helping your staff understand the benefits of the vaccine?
Our clinical leaders were unanimous behind doing this. I think that the makeup of our staff mirrors our makeup of our community. So some of the same issues that we have within the community in terms of education, those were things we needed to do with our staff. So we made sure, just as we did with anybody in the community, that individuals, whether in our IT department or the call center or whatever department they were in, that we were taking the time to make sure that we were educating them as well. And our chief medical officer reached out and had personal conversations with anybody who had questions and that wasn't vaccinated. Our occupational health made sure they reached out and talked to everybody. So there was an ongoing effort for education along the way. But I think there was an understanding, especially on the providers and from the clinical teams, that this was really an essential step and important for us to set that example for our community as well.
And what was your perspective on that, Jeanmerli, that whole process, how it went at Lowell?
I think it's unique because we have, a group of people that were already signed up before the vaccine was ready. And then there was the group of people that were still trying to figure out what they wanted to do. But I think we served as examples for one another. So you saw kind of like the waterfall. The first group got vaccinated, and then they're like, oh, look, they're good after a few weeks. It's my turn. And then we kind of pushed each other, right? I felt like we were so supportive with one another to be like, I got vaccinated, I'm okay, you got this, you can go do it too. And a lot of us we met, I know at one period of time we were all remote. So I think the best part was going to kind of see each other with our masks and be like, oh, hey, it was nice to see you in person. And that kind of, we would actually send each other kind of selfies of everyone getting, vaccinated and things like that. And that kind of brought up the morale of getting vaccinated. It was good. It was something good. A lot of the education went through. And we supported one another. We were like, we're friends. We want to make sure that we're taking care of each other. So I think that's, my perspective of it all.
So as we begin to close out, we know that it's been a grueling 18 months for you and your coworkers. How are you holding up? I'll start with you, Jeanmerli. How are you finding ways to replenish your energy and keep going in the morning?
Yeah. I think it's understanding that, this is a learning process, and that we're not on a short trip. We're on kind of a long haul, and that we want to make sure that we're just checking in on each other. I think that's a lot of the things we've been doing on our end. And then, I'm grateful for the health center and they're thinking about us, and they've provided opportunities to go in and get treats or things like that. And we've also been able to, as a team, we're planning on doing some self-care activities at the end of the month, and it just keeps us going. And I think a lot of what keeps us going is just our passion. We have our passion for the community, and I think just making sure even that one person I think that one person that just gets vaccinated, that keeps us going. We're like, oh man, that's one person. Let's go to the next one. So that just, motivates us to keep going. It doesn't have to be 60 people. It doesn't have to be 100 people, but just that one person. Like some of my coworkers just get so excited. And I do too, because, it kind of just validates what we've been doing and that it's working, even if it's just one person.
What do you think, Brent?
I don't know that.
How have you and your coworkers? I know you're relatively new, but
Yeah.
still, your perspective on how Lowell's staff are kind of keeping themselves motivated.
I don't know that I could say it any better.
And mentally.
I don't know that I could say it any better than that. I mean, that I think what Jeanmerli said really sums it up.
I feel like, in terms of the what's working, you're able to cover what you feel like as the promising messages or tactics for vaccinating your community.
I mean, it really does boil down to, there's no one magic solution. It really is a one-on-one time period right now that you really do need to reach out to each person individually, and based on that person's age, their background, um, their personal situation at home, the way they're going to get information is going to be unique to each individual. So we need to do our best to leverage as many tools as we can to reach those people. And sometimes it's video, sometimes it's text message. Um, a lot of our patients actually share phones amongst their families, so their number's constantly changing. So, or the person you're trying to reach isn't the same person because somebody else in the family has it. So, in those situations, maybe the tabling at an event is the best way to do it. So, we're continuously working to innovate and find new ways to reach as many people as we can. Um, and 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 I think that's, everybody here is so driven by our mission, as Jeanmerli had said, and that really makes the difference. I mean, our workers they're tired, but they're also, afraid of getting sick, and they're trying to care for their loved ones and their family, and a lot of times they're helping someone, whether it's somebody in their call service center who's taking a phone call from somebody who is in a crisis of their own because they're scared. So these are all things that I'm not sure everybody thinks about from those different angles. Um, it goes beyond just the physical hours that people are working. Um, and we're lucky because, our CEO has met with our Secretary of Health and Human Services here in Massachusetts, and the U.S. Secretary for Health and Human Services came to Lowell and met with our CEO as well to talk about workforce issues. So we're being heard. There's no quick solution, but it is good to know that it's being worked on and solutions are being discussed at all levels of government.
Thank you. Well, I really appreciate your time today and the work you both do. It's been a pleasure to talk to you.